Hello everyone, my name is Jennifer Jackson. I'm a registered nurse and I'm an assistant professor in the Faculty of Nursing at the University of Calgary. And so these videos are going to talk about theories of knowledge that we use in nursing to inform our practice and also to inform our research. So there's a lot of terminology in this content, so I'm going to break it into two pieces. This is the first piece, which will be for looking at what is nursing ontology, epistemology, and axiology. And so we're going to go through what each of those terms mean and how they apply to both our research and our clinical practice as nurses. So I ask you to take a quick look at this and tell me what you see. Now, some people may look and say they see a variety of transportation. Some people may say they see angles and fixed points and a network of connections between different types of modalities. Other people might say they see lots of different colors. Some people might say they see the tube map for the capital of Canada's colonizer. So there's lots of different ways of interpreting one image. And when we think about those different kinds of interpretations, that can help us to understand why we see the world the way we do and why other people may see the world differently than we do. So we're going to go through some different ways of seeing the world in a bit more detail and talk about how we can make sense of how we understand nursing. So, of course, always the question of like, why does this matter? We want to learn how to, do really advanced clinical skills, and learning about philosophy is not necessarily everyone's favorite. But this is really important because nursing is a profession, and nursing has not always been a profession, but it has worked very hard to get to that point. There are a lot of men and women who helped establish nursing as an autonomous, legitimate, independent partner in providing healthcare services. And that process is still continuing in many places in the world. So when we have an identity around some different philosophical concepts, that helps us to be unified as a profession, no matter what setting we work in or no matter what work we kind of do. But without that, then we don't become a profession anymore. So having our own discrete body of knowledge and our own discipline-specific philosophy separates us from other roles in healthcare. It also helps us to understand why we see things the way we do and how we can appreciate other people's perspectives as well. So we need this because it makes nursing distinct from other roles. So even if this isn't your favorite, try and appreciate that these concepts do have value and they're what help us have professional footing as our own distinct professional group and discipline. So what are we talking about? So the first three terms to consider are ontology, epistemology, and axiology. All a big mouthful, but we're going to go through what each one means and how it relates to our nursing practice. So ontology is a question of what are the things that are involved in nursing and what is the relationships between these things. So we're looking specifically at what is nursing and what is not nursing. So like the Force in Star Wars, our ontology is the thing that binds everything together and connects all of these relationships. So once we understand these relationships, then we can start to change them or improve them. So when we're thinking about what nursing is and what nursing isn't, first it's important to say what concepts are a part of nursing. So why this matters is some nurses might say, yes, social justice is a part of nursing that fits in the nursing world. Other people might say it doesn't. We can have similar conversations for anti-racism, talking about feminism and different kinds of concepts and we can say, are they or are they not nursing? Depending on whether we think they are or aren't, changes our approach to our work. So that's why it's important to think about what do we consider nursing to be, and how are we separate or distinct or different from other types of work. So that's asking what are the things that make nursing. Now when we think about what are the relationships between the things, we want to consider what it is that nurses do, in the sense of, if we have a view that we're working in critical care and our view is nurses do things for patients, the relationship between a nurse and a patient is going to be very different than if we're working in the community setting and we say nurses and patients are partners. So that's not to say that one is wrong and one is right, because if you are in critical care, your patient may not be able to verbalize what their wishes are or how they would like their care to proceed. So you may have to do things and make decisions on their behalf. So in that case, that view is not wrong. The same with seeing nurses as partners when you're working in the community. That view is very advantageous there, and that's how you can build trusting and therapeutic relationships with people when you're in their homes or in other settings. However, if we bring that ICU ontology of how there's a relationship between nurse and a patient and we try and apply that in the community, we might run into trouble. So that's why it matters. How do we understand the relationship between a nurse and a patient? Or how do we understand the relationship between a nurse and a doctor? And if a doctor has a different view of that relationship than we do, what does that mean? And what challenges might we have to navigate in our clinical setting? So depending on how you understand what is nursing and what the relationships between the different components of nursing are, that will impact how you approach your work, but also how you might choose to study nursing and the types of questions you might ask in a research program. So moving to the next concept, epistemology. So with epistemology, this is about knowledge. So ontology was a theory of things in their relationship. Epistemology is a theory of knowledge about those things and their relationship. So I'll give some more examples to explain this further. So with epistemology, we say, why do we believe what we believe? So why do we see some information as being credible while other information isn't? And so what do we truly consider knowledge? So if you are someone who thinks that we need to learn about birth and labor, we can study the stages of labor. We can look at textbooks. We can, perhaps watch videos. We can speak with clinicians. We can run simulation. We can do all kinds of things to understand the process, know what the different stages are, what are expected outcomes, and how we can manage within those. However, if you value experiential knowledge, you might say, you know what, birth is something you can only truly understand if you've been through it. And if you haven't been through it, you don't really know what it means. So depending on which perspective we take, we might feel differently about the way that we work or the way that we engage with our patients and our colleagues, and also what kind of knowledge we think we need. So we can see very clear examples of society of where epistemology can kind of break down and where we can be applying a lens that maybe doesn't suit us as well as it could. So for example, this is where we get anti-vaxxers from. So as nurses, most of us trust knowledge and created from science. We trust scientists. We trust that the things that they are doing in the lab are the best possible things we know how to do, and that their perspective is trying to help as many people as possible. So somebody who has that lens would agree with the statement that, vaccines are the most cost-effective health intervention in human history, and they have decreased the burden of illness in a greater way than any other thing we have ever done. However, if you don't trust scientists and you value experiential knowledge, then you might be more likely to say, you know what, I don't buy into this idea of science. I think they're influenced by, financial interests more than caring for people, and so I don't want my kids to be vaccinated. So you can see how that very quickly creates different groups that might be at odds with each other and at odds with different approaches to how we manage healthcare. So when we think about epistemology, we need to think not only what do we consider to be knowledge and what do we consider to have value, but then how does that relate to other people? And also how can we build trust in our knowledge so that we can help people make informed decisions. And so the third concept that we're going to talk about is axiology. And so this is determining what has value. So for example, axiology can create different things and different lenses in different groups, but for nursing, this is where we get our professional ethics from. So is this right? Is this good? We can do all kinds of things, but should we do them? And particularly in research, this is where we've seen all kinds of studies that have been really unethical because they're things that we technically can do, but we should not have done them. So one example from clinical practice would be looking at, should we give people with addictions high doses of opioids? Or should we decriminalize and then prescribe substances like heroin, crystal meth, cocaine? Because that's going to take a harm reduction approach, and we can then give people like a clean supply of substances. However, you might have other people who say, when I think about what I value, I think that by enabling this behavior, I'm not giving someone the opportunity to make a change in their lives. And so we should not prescribe these high doses of opioids, or we should not be prescribing illicit substances, because that is not ethical for me as a healthcare professional. So if you have a harm reduction lens versus like a sobriety lens, you can see how you can have different discussions with people. And it's not that one is right and one is wrong, it's that they come from a different place, but they both reflect what we value and how we understand about our ethics. So in research, we've seen lots of things where there's been lots of really egregious unethical studies that have not looked at ethics as part of the research design. So the most glaring example of this is research that was done during World War II on people in concentration camps and prisoners of war. So they were things that technically could be done. So for example, we want to test the rubber on the soles of people's shoes. So we will put all of these different kinds of rubber on people's shoes and make them walk until they collapse. That is something we can technically do. However, it is completely unethical, so we should not do it. So axiology is how we understand what is possible versus what is right, and then how we use that to inform our decisions. So I'm going to finish with this slide, and then we're going to have a pause because there's a lot of terminology in these lectures. And so in case you want to maybe watch this again or revisit some of those concepts, do some additional learning, we'll just put a little bit of a page break in here so that people can have a chance to kind of wrap their heads around these different things. And with all of this philosophy of nursing, as with philosophy of anything, it's not something that you learn once and then you understand and that's it. It's something that you learn and revisit and perhaps notice how your perspective changes, and that's an ongoing process throughout your life. So these concepts help us to understand what we do and why it adds value and why we're doing what we're doing and what knowledge we need to be able to do the things that we're doing. We also can look at how this fits in our profession and also how it fits in society at large. So people with different philosophical views of nursing will nurse in different ways. And for the most part, it's not to say that one kind of nursing is right and one kind of nursing is wrong. It's to say that they are different views and they come from different perspectives. And so how can we understand that? We also want to think about how this applies to research. So if you have one set of views for one research topic, that study is going to be different than someone who has a different set of views. When we talk about these concepts specifically in research studies, it's not so much about saying if you have to write out, what would be the ontology, epistemology, and axiology of this study. It's not about, this deep soul searching that you have to dump all over a page. It's about saying, how are you approaching this specific study? So I might approach, one study with kind of a biomedical lens, and so I'm going to act differently with that research than I am with research that's very much based on community participation and fighting injustice. And that's fine. You can have more than one position in more than one project, but it's about saying what values and what perspectives am I bringing to this work, and how is that having an impact on what it is that we do.